We may be coping with a shortage of obstetricians and gynecologists by 2020. Researchers make that prediction with a new study.
And they ranked Detroit number 6 on a list of cities that will be affected. 7 Action News reporter Simon Chowdhury shows us what state medical schools and lawmakers are doing to help boost the number of OB-GYNs.
Compressions.
The field of medicine has many different specialties. Officials at Wayne State University are hoping to encourage more med students to explore primary care. This comes after a national study predicts Detroit will experience a shortage of OB-GYNs in less than 2 years.
Not surprised.
Doug Skinar says he saw this problem coming, which is why Wayne State University and 3 other state medical schools helped come up with a plan called My Docs. He says less OB-GYNs in Detroit means less access for women to improve their health, especially moms-to-be.
Women are not getting access to the prenatal care that they need to help prevent premature birth. Detroit has one of the highest premature birth rates in the country.
The problem, Doug says, is primary care fields like family practitioners, psychiatrists, pediatricians, and OB-GYNs don't pay as much compared to other specialties. That income rate lessens for urban or rural areas that have a high Medicaid population.
Medical students have to pay off their debts, and so they're tending to gravitate towards communities where they receive a higher amount of income.
Another problem school officials say is there are not enough residency spots compared to the number of physicians that are retiring. Residency is a must-have before students can become doctors. My Docs is the first time in Michigan medical schools joined together to combat this problem. It was passed in the state budget a few weeks ago. The 10-year plan creates 500 new primary care residency spots in Michigan through $28 million in funding from the schools, state, along with federal money. Part of the plan is to have those students commit to work in underserved communities like Detroit for 2 years after their residency, with the promise of up to $75,000 in loan repayments.
The residents are the ones who are truly going to benefit.
And the plan kicks in next year by creating 50 new residency spots for primary care physicians, and again, that includes OB-GYNs. In Detroit, Simon Chowdhury, 7 Action News.